Shante Washte, Nape, Chiuzapi. I greet you with a good heart. Chairman Hageman, Ranking Member Ledger Fernandez, and distinguished members of the subcommittee. On behalf of the National Indian Health Board and the 574 sovereign American Indian and Alaska Native tribal nations we serve, thank you for this opportunity to provide testimony on the Purchased and Referred Care Improvement Act. My name is Janet Alkire. I serve as the tribal chairwoman of the Standing Rock Sioux Tribe and the Great Plains Area Representative for the National Indian Health Board. And I want to thank Congressman Johnson for that introduction also. The PRC program is an important part of how healthcare is delivered in Indian country. Unfortunately, the IHS's administration of the program has had significant challenges in staffing, management, provider education, and payment, which has impacted individual tribal citizens and whole tribal communities. When the PRC program is not functioning properly, it not only fails to uphold the trust responsibility, but it also personally damages the lives of tribal citizens caught in the middle. PRC is rationed based on the IHS medical priority levels. To access the PRC program, tribal citizens are required to have been approved before utilizing a referral to outside care. The process is already incredibly cumbersome and difficult to navigate for tribal citizens who are trying to seek care. It can become even more difficult when IHS facilities and area offices are understaffed, leading to significant delays in the approvals for the care. Delays in care worsened chronic medical conditions for tribal citizens waiting to assess a referral through PRC. But even after a patient has received care, those health visits can continue to follow them. Once a tribal citizen has gotten their approval and gone to an outside provider, the bill should be sent to the IHS facility for payment. But the process currently at many IHS facilities amounts to administrative black hole for outside providers and tribal citizens. Once bills are submitted to be paid, tribal citizens do not know if the IHS is completing its part of the process and will not know until the bill arrives. The PRC program also struggles from misunderstanding and poor education in the provider community. Providers and billing contractors often lack an even basic understanding of the Indian health system. It is illegal for providers to bill tribal citizens who have an approved PRC referral. Unfortunately, this does not keep these providers from sending bills to tribal citizens for care they received under their PRC referral. Some PRC providers also frequently lump all services for a patient together, whether they have a PRC approval or they bill tribal citizens health care coverage. When providers do this, it contributes to administrative burden for Indian health providers to work through claims in a timely manner. IHS is a payer of last resort. And this is an administrative burden on IHS when they already struggle enough with staffing to process PRC claims. The Indian Healthcare Improvement Act does not provide recourse for the IHS against these provider practices, nor penalty for PRC vendors engaging in these practices when PRC claims go unpaid. Tribal citizens suffer. They often receive bills from providers and debt collectors for unpaid PRC claims. Tribal citizens who receive these bills are frequently faced with threatening language regarding these bills. Some citizens will pay the claims out of pocket to avoid adverse impacts to their credit scores. Others are not so lucky, often lacking the resources to respond to the provider's demands. In these cases, these bills are turned over to collections. Once a bill is in collections, it damages the tribal citizen's personal credit, and they are chased by creditors and debt collectors for bills that should have rightfully been paid by the Indian Health Service. Because our tribal citizens use the Indian health system for their health care, many are not familiar with health care billing and third-party coverage. Some citizens suffer so greatly from the stress that PRC billing errors, they do not seek follow-up care. The PRC Improvement Act seeks to clarify existing statute to ensure tribal citizens do not bear the burden of these administrative issues and to make tribal citizens whole who have paid approved PRC claims out of pocket. To appropriately implement this legislation's purpose, Congress should provide the IHS funding to make tribal citizens whole under the reimbursement program.
Ms. Alkire, I'm going to need you to wrap up so that we can move on, but we will have an opportunity to question you. So just a few more seconds.
Okay, yes. So in conclusion, I want to thank Representative Johnson for introducing this legislation. It is a small step to repairing the damage to individual tribal citizens and tribal communities for the difficulties and management of the PRC program. Thank you.